Welcome to another edition of Disability and You. I am your host, Ganesh Singh. And on this program, I'll be joined by two individuals from the Guyana Council of Organizations for Persons with Disabilities Orientation and Mobility Program. Those individuals will be sharing information on how persons who are blind and visually impaired can be provided with training on independent living skills and other areas so that they can be reintegrated into society. So stay tuned, and I must indicate or inform you that this program comes to you with the kind support of the National Communications Network. So remember to join me as we sensitize you, the members of the public, on what is happening within the disability community. Joining me on this program is Musa Haynes and Oliver Kerr. Both individuals are officers from the Guyana Council of Organizations for Persons with Disabilities Orientation and Mobility Program. But before I go to those young men, I must inform you that the Orientation and Mobility Program is fully supported by ExxonMobil. It's a one-year program where persons who are blind and visually impaired from regions 2, 3, 4, 5, 6, 7, and 10 will be provided with independent living skills training by officers from the program. So the two officers I have, as I said, is Musa Haynes and Oliver Kerr. Welcome to the program, guys.
Thanks for having us.
Thanks, Vivian. Nice to be here.
All right. Oliver, let's start with you first. Highlight to our viewers the importance of orientation and mobility or acquiring independent living skills as someone who's blind or visually impaired.
Thanks for having me once again. It's very important for person with mobility and living training skills. It's every day and part of you. If you go out there and learn to use your cane or even to in your own home. One of the things I must mention is that when before we just mobility we were doing, now we learning to cook, use your cell phone, and so those things is very everyday. That's part of person's life. So we're using that every day now and bringing that now to person, not just using cane anymore.
It's a whole
whole package, if you want to call it.
Exactly, a whole package of training. Musa, anything to add to what Oliver would have said? The importance of mobility and orientation?
Well, thanks for having me again, Mr. Singh. Like Oliver would have I highlighted earlier, the skills learned in this program will definitely be helpful to persons who are blind and visually impaired. As he said, these are skills that will be put to the test in your everyday life. I mean, simply getting around your house, this is difficult to some people, especially if they would have acquired their disability later on in their lives. Those of us who would have acquired it at a young age, we are more accustomed, but it's usually challenging for those who would have been seeing and now have to adjust to losing their sight. So it's definitely going to be helpful to a lot of people, and they should take advantage of the program.
And I just want to elaborate a bit more on that. You have an increase in chronic illnesses, and a lot of persons are losing their sight as a result of diabetic retinopathy and all other illnesses or diseases. Because of this, they're probably in their 40s, 50s, and even older. And when they acquire blindness or visual impairment at that age, it's very difficult to transition. And that is where, as you said, Musa, the orientation and mobility comes in to help them regain that level of independence in their lives.
Yeah, definitely.
Oliver, what's the experience? You've been doing this for a pretty long time, working with persons who would have lost their sight. What's the experience working with people who probably would have lost their sight in their 40s and their 50s? As some persons will say, the middle-aged individuals.
It's going to be a lot of challenges, as my colleague over here just mentioned. But as I always say, it's not life doesn't stop there. And you can see life is a new beginning. You just got to adapt now to those kind. It's going to be challenging for first, but once you give it a shot, it's going to always work for you. You know, coming out from this program myself in the early days, I know go around and having chat with person, you will see that, you know, you tell yourself once you go back home and you sit down and you meditate on this and you think back on it, it helped me and it bring me here where I am today. There's going out there and now seeking person for, to help train them and getting them back. You know, that part we like to tap into that special person there. You know, somebody out there care for you. You don't have to, you know, wondering that is you alone in this thing. You know, you reach out to the Guyana Society for the Blind, and we are always willing and able for train you and assist you. Sometimes you might not want to use the street, you just want to know use your home. We got person to help you with that too.
To do chores in the home.
Chores in the home.
Or to use a device and so on.
You know, correct. And you know, but going out on the street is very important for you, because sometimes you want something at the shop, and the shop is just a few steps away, but you're just afraid that to going out there, because you're frightened that you might stumble and fall. But here, you know, with a help with a cane, you can get to the shop and back home.
You know, that is so true, because, you know, I've heard stories where someone probably in the middle or in the old age category, they would have acquired blindness, and their relative would leave everything on the table, put on the radio, leave the telephone on the table, leave water, food and everything, and that person sits there until the relative returns in the afternoon. I don't know how they do the washroom bit, but because of the lack of the confidence to move around in their homes, there are quite a few persons who are in that position. And additionally, when you're in such a position, it's very frustrating, very stressful, but it also frustrates the people that are around you, your relatives, your family members, and so on. So that is why it's of critical importance, as both of you would have highlighted, that persons who are blind and visually impaired should acquire independent living skills. You know, you should learn to do things on your own. And these are things that people would have done before they would have acquired that disability. And, you know, you guys are there to teach them on how to do those things as a blind person. Musa, let's you know, talk a bit about your personal experience. You would have been someone who acquired blindness from very young, very small.
Yeah, that's true.
But you were not independent with the cane until you were, what, in your early 20s?
Yeah. The reason for that, you know, personally, I was withheld from using the cane because of family. You know, family said, well, we're always with you, we're going to be by your side all the time. And for most of my life, that was true, because I grew up with a lot of cousins, and almost everywhere I went, I had someone with me. But as you know, you get older, the people around you, they get older, their lives change, your life will change. So it's not everywhere you'd want someone to go with you, and it's not every time you can get someone to go with you. So
basically you were in a position that you were forced to learn to use it.
I was forced to start using my cane on my own, and I don't regret it. Honestly, I don't regret it. I honestly can't go anywhere without my cane, even if I still have that assistance, right? Because the level of independence your cane gives you, the amount of power the cane gives you, it's unexplainable, honestly speaking, because you can do so much. I mean, before I could use my cane, simple things as going to the shop, you know, I might want something, I wouldn't have anyone around me at a particular time, I might have to wait sometime minutes, hours even, before someone can come and assist me to get to the shop. Now, if I want something, I get up, I go get my cane and I go get it. There's nothing there to stop me, you understand? So it's definitely a great help, and it will be helpful to anyone who just commits themselves to learning this skill.
And that is, you know, I can relate to what you just said, because I would have acquired blindness at 17, and you know, I was home for about 5 years, and the reason, or one of the main reason why I was home, is because I did not know what existed. And if they were mobility orientation officers like yourself and Oliver, I would have been able to learn new skills and learn how to deal with my blindness. Even though I would have started reintegration in 2006, until 2009, let's say probably 2009-10, that's when really I started to use my cane a lot more. And one of the underlying factors why I didn't use the cane, it was because I was embarrassed, I was ashamed. And many persons, I'm sure you guys would have encountered, Oliver, you would have probably more than a lot of us, encountered people who are ashamed for people to see them with the cane. What you have to say to that, Oliver?
Well, that is the most important part we try to get across to our client when they come to that same part, the stigma with the cane. But you think of it, your family have them sight and them going about. The cane become your sight, and that is very important for a blind person. I would like to mention this, the person in the street, when they see you walking with a cane, it doesn't that you want to be flashy or you want to be stylish or you're playing some trick of the sort, because most people always feel that you're playing a trick when you're walking with it. It's not so. This is an aid to help you move about to get from point A to point B. And I wouldn't advise nobody to pull it away from person. You have some person will kick it and those kind of things, but guys, an aid to a blind person is very important. So the stigma will go with the cane. It goes a long way, but we're trying to work with that. And we get the more young person like Musa over here was coming out. So we're seeing a lot of young person using a cane. And they'll spell and they'll go far away for the blind community.
Yeah, that is true. Where persons, when they see you with a cane, it's like it's a novelty. It's something that they're not accustomed to seeing. But as you find more and more persons who are blind and visually impaired coming out and using their cane, it's a normal sight. It becomes a part of the society. It's normal.
Correct.
Oliver, you just triggered my memory when we were in Linden some years ago. The two of us walking
Correct.
walking the streets in Wismar.
Yeah.
And people were amazed that we were actually using a cane, because the majority of blind persons in Linden, they don't use the cane. So people are not accustomed seeing two blind persons walk the street using the cane. So when people are not accustomed and it's something strange, that's when they react differently. But if it's something that becomes normal, it's normalized, then I think some of the stigma that is attached and the discrimination that exists might eventually be reduced. But you'll still find those instances where people would make fun of it and those things. But I encourage the members of the public to respect the cane, as Oliver would have said. It's part of that individual who is blind. It's part of them because it helps them to get from point A to point B, as he would have said. And it also indicates that they're blind, so you can offer assistance if needed. If you see that person might need some assistance across the road and so on, it will tell you to go and offer assistance. It doesn't mean they have a cane, they always need help. So don't go pull their hands and cross the road without asking.
That is so true.
Because we've experienced that people just assume you need help. Musa, what are some of the other areas that you guys cover in this program as one of the officers, other than the cane training?
Well, like Oliver highlighted when we first opened the program, it's a full package. We will teach you to operate your cell phones, the device, your tablets, your computer. So
let's zero in on those devices. You might have people who are blind wondering, their touch, how can I use them? But all the touch devices, or the majority, once they operate on the Android platform or the iOS platform, they have a built-in setting that allows them to have text-to-speech, the text-to-speech feature to be activated, and a blind person can be able to use the device with that feature. And that is why you're going to teach them to use the tablet, their phones, and even the computer with the screen reading software like JAWS and others. You guys are going to help them or teach them those skills, because some of those people who would have acquired blindness now probably used the computer before they would have gotten blind, and they would really like to continue to do that. So we talk about cane training, the devices, computers. Oliver, you want to elaborate a bit more on what is going to be done in the home?
We have stovetop training. There's learning the various knobs of the stove if you recently lose your sight. Even though you were doing it before, now is a new technique you have to learn. Now you lose your sight. So it's actually like training you all over again how to use the stove. And so we call that stovetop training. Either we can come to your home or you can make contact with the institute and we can teach you how to cook and clean up the kitchen back when you finish. So you have a tidy environment.
So you'll also teach them how to cook?
Correct.
And anything to do with like washing of clothes, folding clothes?
Yes, all of that is part of it. The whole setup is the whole of being home and being independent of your lives and your surrounding.
So it's I'm really hoping that viewers out there who probably are blind and visually impaired, or they have a relative who's blind and visually impaired, will make use of this program. As Oliver said, the officers are based at the Guyana Society for the Blind, but the program is the Guyana Council of Organizations for Persons with Disabilities Orientation and Mobility Program, with support from ExxonMobil, and the program is for 1 year. So people need to really maximize on the opportunity now, because we are not sure if funding would be available to continue the program after the year has been completed. What has been your experience? The program would have started a few months ago, Oliver. What would have been your experience working with one of the new clients? If you want to share, just, you don't have to mention name, but just share a bit about their story.
It's very excited for the person because they want to learn new things. One of the person that I've been training recently, she's so excited about this program that she wants to learn everything that is offered up. She's interested in, and that is the key, and to make our job more easier as officers. That once you got a person willing to learn and wanted to be part of the program. But just let me expand on that a little bit. It's not just the person who are blind be willing to train, also the family. Because that's the biggest part. The person can willing to want to train, but we have to get family who supporting likewise. So we are asking family out there, when the families be part of this training, if them is like to be part of it, it open up to them too.
And that's a good point you mentioned there, Oliver, because yes, a blind person or a visually impaired person might want to be part of the training, they are willing, but then their relatives will tell them that, no, we'll help you.
You don't need to cook and those.
You don't need to cook.
But
and you will have this negative energy around you, but you need to be strong. You need to be strong as a blind person.
Correct. You need to take back own of your own life, Yes, you might have a little challenges now, but we don't ever consider that now. When you get to learn these skills, you will see yourself no more as a blind person. People have to remind you that you're a blind person, because everything you're going to do for yourself. I do everything for myself. I even go to the stove, I bake, I cook, I do everything for myself. So there's some of the knowledge I like to impart to person out there. Because it's one thing for have this knowledge of yourself and not sharing it. I don't think it'd be a good thing. Because you have a fellow blind person who's out there willing to learn. And then once they're willing to learn, I'm willing to teach.
That brings me to the next point. Viewers might be wondering, how can these guys who are totally blind, because both Musa and Oliver, they're totally blind, how can they teach persons who are blind and visually impaired to be independent? How would they see to teach them and all of that? Because these are questions people would ask, and these are things that people are thinking. So it's good that you brought the point out that although you're blind, you're still capable to teach other persons because you have the skill set, you understand it. And
before you go on, you can relate to what that person is going through, because you in the same position. So basically, teaching them, it will come easily to you, because you will know all the what they want and the needs, because you have the experience and you come in from a position before. So right away you can relate to that person when you're teaching them.
And how do you guys deal with this mind block that some person might have? The not having the confidence, or they want to learn, but something is telling them no, no, no. How do you guys deal with that?
Well, you will always find that. You can't run from that.
Yeah, that's
Because
true.
you will run into them kind of situation. But being around us and you continue to coming out, give yourself a few mornings. Well, we maybe have to do some counseling with some person.
And that is provided too, right?
Yes, that is part of the program likewise. But once we get over those blocks and those hurdles, them is smooth sailing to me, is where I'm concerned. But once again, we can only do so much. You have to want it.
And that is true. You have to
You
want.
have to be the hunger for want this thing. It's like food into your system. When you now lose your sight, it's all over again. You have to start over something.
But you gotta want.
But you
to be
gotta want
independent.
it. 'Cause I can't just come up to you and tell you this is what. But I gotta find from you what you want to do before I can help you with something.
And life doesn't end after disability or blindness. It doesn't matter if you're 40,
And
50s,
this is
or
always my
60s.
belief. It's all new life and new experience out there.
And you can learn
Sometimes
a
your
new
friends
skill.
might leave you, but you get new friends. You meet new friends.
Yeah, because some friends, when they have a disability, they want not much to do with you.
Yeah, but once again, it's the stigma once again. Nobody
Uh-huh.
want to see socializing and going out there with a blind person. But we live a regular life like everybody else. It's just that we don't see. Yeah.
And so, Musa, how the social aspect, how important is that to somebody who's transitioning from a life of sight to a life of blindness? How socialization with other blind persons, how important is that? Oliver would have mentioned a few things, but if you want to elaborate a bit more.
Well, socializing with other blind persons is very important, because you come out, you socialize, you get to hear stories of empowerment, stories that will make you, when you first acquire your blindness, your usual mindset is you're very depressed, feel like it's the end of the world. But when you come out to the Society for the Blind and other organizations, you get to socialize with people. People get to share stories with you, situations that you're currently being faced with. Someone would have already walked that road, and they will show you all the bumps you are, all the rough spots, and help you out. So it's definitely important. Socializing is important because
With other blind persons.
yes, the more you isolate yourself, the harder it's going to become for you to accept that part of your life. So socializing is
And
definitely-
socializing will help you, with the depression. Some persons might be, suffering depression. You'll also be inspired and motivated because when you see persons who are blind that are successful, having their jobs, degrees, having their families after they would have gotten blindness, it helps. And, I can definitely allude to that. It definitely helps when you see other persons living successful, normal lives. It motivates you to want to be there.
yeah.
So anything final you want to say, Oliver?
Yes, I would just like to say, just to expand on what Musa was saying, is that aunt and son just realize that you're the only blind person in the world. Even though you might see blind person, yes, but when it happens to you, you always feel like you're the only person in this world that you're gone blind. And there's where socializing is really very, very important to a fellow blind person. We all sit here and we can talk from our own experience. Cause one time or the other we was there, and now we somewhere else. Cause we go out now and meet up with one another and discuss certain issues that we have with each other. Everything we have a discussion upon. How we get from one spot to the other, we help each other along that way,
Excellent.
and that is the key. As a blind person, that we must need one another support at all times.
And definitely support network is very, very important. Musa, anything final from you?
Yeah, like Oliver said, the program is here, the officers are here. So once persons who are blind and visually impaired are willing to commit themselves to the program, training is available. I think
And it's free of cost.
it's free of cost. Yeah, I should add that. So you should take advantage of it for the next year. Yeah.
Excellent. And viewers, I just want to provide you with some information. If you're blind or visually impaired, or if you have a relative, a friend, or someone that you know who is blind or visually impaired and you think that they might benefit from this program, as Oliver and Musa said, there are a number of areas that training will be provided in. That includes using your phone, tablets, computers, cooking, completing chores in your home, walking the road, cane travel as they call it, using transportation, and even rehabilitation counseling. It's all provided under this program. You can get in touch with the Guyana Council of Organizations for Persons with Disabilities. Check out their Facebook page at facebook.com/GCOPD, or you can also get in touch with me, 652-8975, 652-8975, or you can get in touch with the officers that are based in Region 4 at the Guyana Society for the Blind on 226-4496. That's 226-4496. We have offices in regions 3, 4, 6, and 10, but services are provided to persons in region 5, 2, and 7. All right, so please do reach out if you know that you can benefit or someone you know can benefit from this program. Again, it's free of cost. So I want to thank you very much for joining me on another edition of Disability in You. Remember to join me next time so that I can share with you information coming out of the disability community. Ganesh saying goodbye.